Senator Kyle doubts people die from lack of health insurance. He doubts that in the U.S., anybody is dying due to lack of health insurance. Let's take a listen to what he had to say. And this was with David Gregory. It looks like David Gregory is actually understanding what we and many other critical blogs and radio programs have been saying for some time, which is for the cost of the two wars that we've been fighting for years, the U.S. could have had health care bought and paid for. Absolutely. And I think Republicans are basically living in a fantasy world if they can go on TV and say Americans aren't dying because of lack of health care. Take a listen to John Kyle.
And is it a necessity to tackle the fact that there are more and more Americans who die because they don't have access to health insurance?
I'm not sure that it's a fact that more and more people die because they don't have health insurance, but because they don't have health insurance, the care is not delivered in the best and most efficient way. Republicans have a lot of good ideas, and all those amendments Chris was talking about were technical amendments. We have very good ideas about how to tackle this problem one piece at a time and basically regain the trust of the American people by taking one step at a time, rather than saying that we have to have a $1 trillion bill. Yes, that will hurt our deficit. Remember, we just had the figures come out earlier this week, a $1.4 trillion deficit, more than all of the last 4 budget deficits combined.
Okay, it is indeed a fact. Nearly 45,000 annual deaths are associated with lack of health insurance, according to a new study published recently by the American Journal of Public Health. That figure is about 2.5 times higher than an estimate from the Institute of Medicine in 2002. I don't understand how Senator John Kyle, John McCain's colleague, can go on national television. I mean, I understand how he can do it. I don't know how he can do it and do it in any kind of relative good conscience. Go on national television and say, it's not clear that anybody is dying because of a lack of health insurance. I just don't get it.
And instead what he says, which almost sounds like the same thing to me, is that people are dying instead because they're not properly taken care of in the with the healthcare system.
Right, because they don't have insurance. I mean, it's either...
Well, obviously because they don't have insurance.
It's either a complete dissociation on his part, meaning he's completely lost it here. He has no idea what he's talking about. Or it's word games, or it's semantic games, which we know is a favorite among many senators and congresspeople. The word games. Let's just call it something else, and then it'll be something different. People aren't dying. If you don't have health insurance, you don't die because you don't have health insurance.
They're dying because of poor care.
You die because you get bad care because you don't have health insurance. Oh, okay. Yeah, so the study, let's scrap that study. They're off by 45,000. When they say 45,000 annual deaths, they actually mean 0. That was the truth. It would have been nice if David Gregory followed up and asked John Kyle to back up why he thinks Americans aren't dying over health care, but at least he asked the question. We can't fault him for that. It's something, at least, even if not much. And then we have Arlen Specter, a new Democrat who's upset that the Republicans aren't cooperating. Let's take a listen to what he said. Former Republican Arlen Specter, the newly transferred Democratic senator.
On the Republican side, it is no, 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 a party of obstructionism. You have responsible Republicans who had been in the Senate, like Howard Baker and Bob Dole and Bill Frist, who say Republicans ought to cooperate. Well, they're not cooperating.
There's something, I've always kind of liked Arlen Specter, but I'd feel much, much better about him now if his switch from Republican to Democrat wasn't maybe not 100%, but 99.9% motivated politically to win re-election in the Senate. And if you remember, it didn't look good for Arlen Specter in the Republican primary for 2010 in Pennsylvania. So he switched to the Democratic side to be able to skip that Republican primary, knowing that he has a lot of support from independents and from some Democrats. I just wish I felt at all like it wasn't politically motivated. And it is true, he's always been somewhat of a more moderate Republican, but
he's backing it up now with, you know...
yeah, I mean, how much of it is just him feeling like he has to, right? I don't know. It's just... They're all politicians, I guess. It's really... I guess we shouldn't be singling out Arlen Specter. Everything anybody does is politically motivated in Washington, D.C., but I don't know. Now, on healthcare, what does the public want? Well, it's still very, very clear that the public wants a public option. 57% of Americans in a new Washington Post poll support a public option for healthcare reform. Interestingly enough, they care more about a public plan than about whether the finished legislation had bipartisan support. So all of the talk about this has to be a bipartisan bill, which I don't disagree with. It would be great if it was. People don't actually care about that nearly as much as they do about just getting a public option. And like we said a couple of weeks ago, there is more support for what's the easiest way to say it? It's easier to find people who believe in UFOs than it is to find people who oppose a public option when they're asked fairly, not when they're asked, would you be okay with losing your private insurance if the government puts in place a public option? That's not a fair poll. I think anybody other than Republican pollsters would say that is not a fair poll. Republican pollsters would say, no, it's fair because that's what would happen. But I think most reasonable people can agree that's not a fair way to do a poll. If we look at fair polls, there is overwhelming support for a public option. Now, if you watch the recent, speaking of public option and Fox News specials, if you watch the recent Glenn Beck doctor special, you would think, hey, almost every doctor doesn't want a public option. They're against this. They're against what they're calling Obamacare. Doctors are against just about everything that Barack Obama wants to do, if you believed the Glenn Beck program.
And we've talked about what the vast majority of doctors are in favor of.
Well, but not on Fox News.
No, I mean here.
In the real world.
Yes.
Well, there was this Glenn Beck doctor special. They have this kind of stadium-style seating. He stands in the middle of a big room surrounded by doctors, most wearing white lab coats. I can't imagine they were really coming right from their offices, especially since many of them came from all over the country. Of course, asked, let's put on the lab coats. Many doctors don't even use those white lab coats anymore in their practices. I can't remember the last time I went to a doctor that actually came in wearing a white lab coat.
Nor can I.
Yeah, and Lewis, you just had a number of eye procedures. You've seen a lot of doctors.
Yes, many.
You'd think at some point, well, actually, we have the same eye doctor. I think he actually does use the white lab coat.
I can't really remember, but
yeah. Not a very personable guy, so it's hard to get a read on him. Kind of a cold fish.